You know, right now, whether you feel it or not, there's a silent microscopic war being waged inside our bodies. When a virus gets in, it's not just making you sick, it's staging a hostile takeover. But lucky for us, we've developed some incredibly clever weapons to fight back. So let's dive into the ingenious strategies of antiviral drugs and see how they turn the tables on these tiny invaders.
So picture this. A virus is like a tiny hijacker, and your healthy cell is a high-tech factory. First, it sneaks past security, that's infiltration. Then, it storms the control room and literally rewrites the factory's master blueprints with its own malicious code. And finally, it forces the entire factory to stop everything it's supposed to be doing and start churning out thousands and thousands of new virus copies. This factory takeover is the fundamental problem we have to solve.
All right, so how do we fight back? Well, our first strategy is all about sabotage. We're going to throw a wrench in the works right at the very end of the production line. And this is where a brilliant class of drugs called protease inhibitors comes into play.
Now this is where it gets really clever. You see, the hijacked factory might produce all the individual parts of a new virus, but they're kind of like a piece of furniture that's still in the box. They need to be assembled to work. The protease enzyme is the special tool the virus uses for that final assembly. So protease inhibitors just block that tool. The virus can make all the parts at once, but it can never build a finished, functional product. It's an absolutely brilliant act of sabotage.
And where do we see this amazing strategy in action? Well, its real claim to fame is in managing some of the most relentless, long-term infections out there. These drugs are an absolute cornerstone in treating HIV and chronic hepatitis C, diseases where you have to constantly stop that final viral assembly to keep the whole infection under control.
Of course, a strategy this powerful, messing with fundamental processes like this, it doesn't come for free. There are always trade-offs, and in this case, they can be pretty significant.
And wow, here's that trade-off in sharp focus. That is a daunting list of risks, but it makes sense when you think about it, because these drugs are so good at interfering with enzymes, their effects can spill over, impacting how our bodies process fats, which can jack up cholesterol, and putting a real strain on crucial organs like the liver. It's a perfect example of the tough calculations that patients and doctors have to make every day.
Which naturally leads to the big question. If the risks are that high, why on earth would we use them? Well, it all comes down to a crucial balancing act: risk versus reward. For a life-threatening illness like HIV, the benefit of stopping the virus from completely destroying your immune system is, at the end of the day, far greater than the potential risks of the treatment, especially if those risks can be managed.
Okay, let's pivot to strategy number 2. This one is totally different because it intervenes much earlier in the process. Instead of waiting to sabotage the assembly line, this approach stops the hijacker from ever rewriting the factory's blueprints to begin with.
And this is the job of integrase inhibitors. Remember how the virus needs to physically stitch its own genetic code into our cell's DNA? Well, it uses a special enzyme called integrase to do that. These drugs simply block that enzyme. That's it. No integration, no takeover. The cell's master blueprints stay safe, and the viral replication is stopped dead in its tracks right at the source.
Now, because the strategy is so incredibly targeted and effective, integrase inhibitors have really become a go-to weapon in modern HIV treatment. In fact, they're often the first choice for doctors because they work so well, have a better safety profile, and are less likely to mess with other medications a person might be taking.
But you know the drill by now. In the world of medicine, there's rarely, if ever, a perfect solution with zero downsides. Even this top-choice strategy has its own set of potential issues to keep an eye on.
Yeah, so while they're generally tolerated a lot better, you can still see things like headaches, insomnia, maybe some weight gain. And there are even very specific risks tied to individual drugs in this class, like a potential risk for neural tube defects with dolutegravir if taken in early pregnancy. It just goes to show you how personalized and careful these treatment decisions have to be.
And now for our third and final strategy, and this one is a real curveball. It's completely different from the other two. Instead of directly attacking the virus's machinery, this approach is all about rallying our own troops. It's about sounding the alarm.
Meet the interferons. These are actually signaling proteins that our own bodies make. So when you take them as a drug, it's like slamming the factory's big red emergency alarm button. Interferons don't fight the virus themselves. Nope. They just send out this massive, system-wide signal that basically screams to your immune system, hey, we've got an intruder, all hands on deck, right now.
And because you're basically weaponizing your body's own natural defenses, the applications for this strategy are incredibly broad. I mean, look at this list. It's a real testament to the raw power of our immune system when you kick it into high gear. We use it not just for viruses like hepatitis, but also for things like multiple sclerosis and even some types of cancer.
But let's be real. Putting your entire immune system on high alert, that is an intense experience. This isn't a precise, targeted strike. It's an all-out defensive war, and that can cause a whole lot of chaos and collateral damage throughout the body. So here's the key thing to understand. The side effects of interferons feel exactly like having a bad case of the flu because that's literally what's happening. The fatigue, the fever, the chills, that is your body going into full-blown battle mode. You're feeling the effects of your own massive immune response.
Okay, let's take a breath. We've just walked through 3 totally distinct battle plans, all designed with one goal in mind: to stop a virus from taking over. So let's put it all together and have a quick final debrief.
So there you have it, laid out side by side. You've got Strategy 1, sabotaging the assembly line with protease inhibitors, mainly for HIV and Hep C. Strategy 2, blocking the blueprints with Integrase inhibitors, a top choice for HIV. And Strategy 3, sounding the alarm with interferons, which supercharges our own immune system to fight everything from viruses to cancers. 3 different targets, 3 powerful ways to wage the same microscopic war. But here's the thing. This battle is never really over. Viruses are absolute masters of evolution. They are constantly changing and adapting to get around our best defenses. And that leaves us with one big, critical question for the future. As we develop even smarter drugs, how will viruses evolve in response? And what will the next battlefront in this endless microscopic war even look like?